5-year-old Brecken Reynolds of Concordia seemed fine when she left the hospital as a baby, but little by little, she changed.
She was a little bit blue and belly breathing, very deep, labored breathing. I knew something was wrong.
At 5 weeks old, Brecken was airlifted to Children's Mercy Hospital in Kansas City, where she was diagnosed with a congenital heart defect known as transposition of the great arteries. She's been through a lot since then.
She has had 4 open heart surgeries, 11 heart catheterizations, and numerous other procedures.
Recent research shows a simple pulse oxygen screening may have changed Brecken's story. Neonatologist Dr. Heather Morgan says it uses equipment most facilities already have. A small probe is placed on baby's skin to measure the blood oxygen level in the right arm and left leg. A difference of more than 3% can signal a problem.
There can be a narrowing of the aorta, which is the big blood vessel that comes off of your heart and feeds oxygen to the rest of your body.
Babies initially can compensate because they're born with an extra blood vessel, which closes anywhere from several hours to several days after birth. If a congenital heart defect is found, baby can get medication to keep the vessel open until surgery can correct the problem.
Babies can die, and they can die very quickly because once that PDA closes, then they may not be getting enough blood to their lower extremities or to their brain or to their kidneys.
But not all babies are being screened. Dr. Morgan says Stormont Vail has made it standard practice since it became a federal recommendation 18 months ago. And in a 2012 survey, KDHE found 78% of babies in Kansas were being screened at birth, but that represents only 30% of facilities. KDHE is now teaming up with the Kansas Hospital Association, American Heart Association, and March of Dimes to educate on the importance of the screening and determine the obstacles facing those who aren't doing it.
This is saving babies' lives.
Kim agrees. While she can't change how heart disease is limiting her daughter's life, she can urge others to take her family's story to heart.
I promised her I'd do everything in my might so that no other mommies and daddies and babies had to go through this.
Tonight, we continue to put a face on what is considered the deadliest of all mental disorders, eating disorders. At 6, a young woman from Emporia shared how an obsession to be perfect set the trap. Now we hear the work it took to set her free. In a matter of months, Megan Bollinger's quest for healthy living,
going on walks and cutting out fast food,
went horribly wrong.
There wasn't a trauma. I am wired to have this obsession with perfectionism.
From fall 2008 to April 2009, when her parents forced her to check into an inpatient treatment program,
I said really cruel things to them.
Her weight plummeted from a petite 115 to a literally deadly 76 pounds.
We thought, what triggered this? What made it happen?
Unfortunately, experts say it's a question with no easy answer.
It does seem to be associated more with people who have anxiety, depression, obsessive-compulsive perfectionism.
Dr. Ann Sachs of Topeka's Cotton O'Neill Clinic says anorexics in particular don't see what's facing them in the mirror.
Even though others recognize that they're so thin that it's not healthy, their mindset just can't grasp that.
Which means convincing them to get help can be a challenge. She says treatment will take a team approach, and the sooner family and friends speak up, the better. It took more than 2 months for Megan to admit she needed to change. She remained hospitalized for 2 more months after that.
I see all of these people and I realize, okay, this isn't a life. I have to give this best friend up because it's killing me.
But it was not and is not easy. In fact, she says it's terrifying.
You have to face the thing that scares you the most so many times a day because you can't avoid eating.
But she knows she doesn't want to go back.
It's kind of alarming.
She showed me photos her parents took before taking her to the hospital. At the request of Megan's therapist, we aren't sharing them close up on camera. They didn't shock Megan then. They do now.
I see nothing beautiful in this picture.
But both she and her parents see great value in her words.
Even if we would have known one person in our area that had an eating disorder and they would have talked about it and shared it, it might have been something that we would have been able to have realized earlier on, and have done things totally different.
It takes over your life unless you get help. It's not a choice.
It's a reminder she keeps close at hand,
For it is by grace you've been saved.
believing that in saving herself, she might show someone else the grace shown her.
When I'm sharing my story, it helps me remember why I fight every day, and how dark of a place that is, and how I would never want to go back there.
While she recovers emotionally, the anorexia did leave Megan with some permanent damage to her heart, bones, digestive system, and possibly her fertility. She says if you know someone with an eating disorder, be persistent in trying to reach them. We are going to have posted some more information from Dr. Sachs and resources to find help at WIBW.com. Stormont Vail CEO Randy Peterson has a hospital filled with doctors who could tell him the dangers of the pertussis outbreak in recent years.
It's not a theoretical. It actually has happened.
But it was the message from his daughter Megan in Manhattan, expecting her first child, that he heard most loud and clear.
It was pretty much, if you want to see your new granddaughter, you're going to have this vaccination.
Babies' bodies can't respond to an immunization for the first 2 months of life, so health experts say it's up to others to provide that dose of protection.
Anyone in the child's environment should be immunized, and that provides this protective cocoon around the baby until the baby gets old enough to get their vaccines.
It's all about keeping the infant safe from this. While pertussis is annoying for adults who get it, for babies, that telltale whoop and the cough can prove fatal.
They cough and they cry and they cough and they cry, and they can't breathe correctly.
Harris says any children in babies' environment should be up to date on their immunizations. Any adult who'll be in contact should be sure they've had a booster, and mom should get the vaccine after 20 weeks every pregnancy.
The mother then is protected, and then the baby with each pregnancy gets the antibodies from the mother, and they last about 2 months.
Peterson has double the reason to pay attention. Both of his daughters are expecting babies this fall, making the awareness he had in his professional life now very personal.
When it is personalized, that it's my new granddaughter, I'm not going to be able to see, or shouldn't see, without that vaccination, then it very much hits at home.